Yeah, it'll still buzz. That's all right. Okay, here we are again. I think I've lost how many times we've done this, Andy, but I don't really care because I want to keep doing it because, well, what's in it for me? I get a lot out of these every time we talk.
Oh, absolutely. And I mean, I think it's beneficial for all of us to get together if we can once a week to go over this, because again, I learn a lot. You learn a lot. There's patients that are suffering. I mean, I had 2 patients come in this morning that failed neck surgery, had a car wreck. Another one had a car wreck years ago. L4, L5's damaged. They see me on a commercial on TV. And again, it's they come in and they're here to get their life changed. And this way, with being on the internet, we actually are able to reach through I guess what I call a wider net. And again, if people just need help, you and I know doctors all over the United States that can help these people at a very, very advanced level. And I think too, what happens, and I know you and I talked about this, for acute care, medicine is the best in the world at that. Nobody's arguing that. We're not even talking about acute care. We're talking about chronic care. And when people suffer from chronic care syndromes, or chronic health syndromes, they think that, well, after I have a whole bag of drugs, 15 or whatever, and they're just like, okay, well, nobody can help me. None that medicine may not be able to help you with these chronic problems, but that doesn't mean you can't get help. Right. And that's what my book is about. Is my entire clinic. If you came in here right now and saw all the people in here, every single one of these people are medical failures, and that is they went to medical doctors for years, if not decades, with an S, and they couldn't get results, and they come in here and it totally changed their life. So again, I benefit, you benefit, and then people listening on this podcast potentially can benefit because to realize hope, that there's hope out there.
Yeah, there is, and this is the first time we've done this, Andy, that my sister has not been the first one to say something.
Okay.
Christy Malden says, yo. So hey, Christy, what's up? Yeah. Welcome to the ride. Now you're going to notice something I strategically placed right here behind me.
Absolutely. I'll see that.
This morning.
Yeah, that's an incredible book, man. I tell you what, but I appreciate you having it, promoting it, and so it was a wonderful thing for me to write this and publish it. It went #1 on Amazon for new releases. It actually went #1 in pain management and #1 in natural health or natural healing. I can't remember exactly, but it was kind of hit the trifecta. And we were just hoping to get the word out. So, and I appreciate you doing what you've done and other doctors. And I tell people all the time, I'm just, I have a private practice, but I'm in a network of doctors throughout the United States and world. And, we all are here striving to improve the quality of our lives and the quality of our patients' lives. I mean, most of the reason, just like with you, I mean, the reason you're able to help all these people is because you went to seminars, either for yourself or your family. Because, I mean, I know with with her thyroid problem, I mean, I think I talked about this before, but they're testing the TSH, which is that test hadn't changed since 1965. Right. And that doesn't mean that technology and able to help people. It's like this was a system that came out in 1965. And the sad part, I guarantee you, if anybody Googled the top 10 selling drugs in the United States, Synthroid or some type of thyroid medication would be #1, #2, or #3. So see, the problem is from a prescription drug standpoint, they have no interest in getting you better because just the sheer quantity and of the medication that they're selling. Right. And that's part of the catch-22 is if people are making billions of dollars, why do they want you better? It's not in their best interest to get you better. And it's, we're just going to do this antiquated, outdated 1965 test to test your thyroid stimulating hormone. And then if it's abnormal, we'll give you some type of synthetic thyroid and never looking at, hey, does this person have an autoimmune disorder? And then this is where I'd like to plug that Dr. Datisa's book. Why is my thyroid? Why do I have thyroid symptoms when my lab results are normal? Yeah, there you go. And he breaks it down as in plain English as you can. Is there's only one pathway that's actually positively impacted by the synthetic thyroid medication. Only one, and I believe there's 9 basic pathways that govern. And don't quote me because I hadn't read this book in a long time, but nine pathways that actually govern thyroid function. And when you take that 1965 antiquated, outdated test, then you're actually at best hitting you got about a 10% chance of improving with that. And that's why most people don't. So, and I had to go out and find all this on my own to help my wife, Faye, improve the quality of her life with thyroid. And then you know what? Then you find out through studying all this that there's actually right now, there's about 30 million people just in the United States suffering with thyroid problems. And then what's, important with that is it's not a standalone. I mean, that thyroid problems are not, because you have thyroid receptors in every cell in your body. And then when your brain, the neurons aren't getting adequate thyroid stimulating hormone, it can't function right. Then it can't produce ATP. Then it can't produce the neurotransmitters like serotonin. And then next thing you know, somebody's taking antidepressant medication just simply because it's linked and it coexists with a brain-based disorder.
But your doctor was successful because they got those numbers into their range.
Yeah. Oh, yeah.
And from that point on, it's just, when this symptom pops up, we're just going to throw this medication on it. And that's, that is quote unquote being a clinician.
And if I may add, talking about the war story of the week, for me, it's not even in the last week. We're talking a couple of years ago. I had a husband and wife that came in, and 3 kids. They're in their 40s, and she came in with thyroid problems, and we were marketing for metabolic disorders, and she's like, I'm done almost. I'm at the end of it. And she said, my husband and I have literally sat down and talked about, how does he take care of our kids when I'm dead? And this is a 40-year-old woman talking like this, because what happened is she had listened to the wrong doctors for 20 years, and she literally thought she was going to die. And well, she may have if she had continued down that path. I don't know. But she comes in, we do all of this metabolic testing and find out what is triggering this thyroid problem, this autoimmune problem, her brain-based problem, and totally 100% transformed this woman's life. And I mean, we're talking about a person that thinks she's going to die, and within 6 months, it wasn't like it was 5 or 6 years we needed here. It was 6 months, and it was totally transformative for this woman. And I guess that's what I want people to understand is if you go to the right doctor. I mean, Brady, I wish people would come in here and, they get wrong information and they keep going back to a doctor for 10, 15, 20 years, and then they come in here and we tell them it's going to take 6 months of intense stimulation and diet and exercise and maybe take a year. And some people just don't want to do that because they're not committed, but yet they go to somebody who's virtually destroyed their life instead of coming into somebody who actually has the ability to let the body do what it's designed to do, and that is heal itself. But again, that's few people that do that. Most people want to come in and say, hey, whatever needs to be done, let's get it done, because I'm just tired of living this way.
Well, I think more and more people are starting to realize that they've gotten no answers. I think one of the biggest things, I don't want to get like political or anything like that, but one of the biggest things that we could do to make change in the right direction is make it illegal for companies to advertise their drugs on TV.
Absolutely. Absolutely.
We're one of the very few countries that actually does that. And what ends up happening is you get your degree from Dr. Google. You see this TV ad where you go down and say, I like that. I've got heartburn. I want Prilosec.
Yeah.
And the doctor just wills it over instead of just looking into it. Tonto Simpson, man. I have not heard from Tonto in years. Hey, buddy.
Hey, Tonto. Good to hear from you, man.
I tell her the thyroid is based on diet. My sister pipes in, wish someone I love would believe me when I tell her that the thyroid issue is based on diet and not hereditary. Jen, I think I know who you're talking about. We won't go there, but it is. There is part of it that is hereditary. But when Andy and I say hereditary, we're not just throwing that out there as an excuse. Like there is very much a gene that is linked to gluten sensitivity and thyroid issues. But yeah, it's hard to get that point across to these people because they're on foods that they're addicted to and they don't want to give those foods up. And it's hard to make a lifestyle change and not just take a medication and go down the road.
Right.
So
yeah, there's no doubt that the medication for people is going to be the easier route. But yeah, I forget who said this, but that's what makes rivers and men crooked is taking the easiest route. It's the path of the least resistance, and so it's again and going back to what you said earlier, somebody has gastric reflux and then they take Prilosec because what they're doing is they're just treating a symptom. And see, when somebody has gastric reflux, that's already a brain-based disorder because the brain controls your gut function through the vagus nerve, and when that nerve is not functioning properly, then your sphincter and your esophagus starts to open up, and then you get acid, if you will, backflowing through your esophagus. Now, the problem when people take Prilosec is we have to digest protein to actually take this raw material and break it down to tryptophan, which is an essential amino acid. And what that means, essential, means our body cannot make this amino acid. It has to get it from outside the body, like eating red meat, for example. There's other meats that you can do but see, you have to ingest this, and your body has to break it down. And guess what? When you're taking antacid, you don't have the correct amount of acid to break this protein down. And then within months to years after this, a person who has Prilosec, now they don't have the raw materials to make serotonin. Now they're on antidepressant medication, and it's just a complete domino effect. And I ask people all the time with these brain-based disorders, tell me when's the last time your doctor talked about your gut function in order to help you improve the quality. And it's zero. They've never done that. And you cannot fix one without the other.
Could you imagine if the instructions for Prilosec came with not, avoiding the standard American diet and practicing vagal nerve stimulation and then taking the medication? Like, there's nothing wrong with taking the medication to get rid of the symptom short term, but you need to be off that stuff and have a plan to be off of it in 2 to 3 months, not take this for the rest of your life and good luck. And oh, by the way, you start taking Prilosec, don't be surprised when neuropathy comes knocking, and then sexual dysfunction comes knocking, and then Alzheimer's comes knocking, because that's what the path you're setting yourself up for.
Absolutely.
Go ahead.
Well, I just something simple, just as we're going to go kind of lateral here just a little bit, but just think of over-the-counter medications such as aspirin. Okay, now we're talking over-the-counter medication. And the warning on that or the directions on that is don't take more than 10 days. All right. And this is over the counter, which is supposed to be safe. Okay. And they tell you don't take this for more than 10 days. And then you talk to patients and they're taking it by the handfuls because of the pain that they're in. And for people that are listening, the reason it states that is because of the liver and kidney damage. And on top of that, the gastric internal bleeding that's associated with taking these NSAIDs. The last time I checked, NSAIDs, these over-the-counter pain medications, kill 16,500 people a year, and these are considered safe. So I want people to think about that just a second when you're taking prescription drugs, and actually Google the name of the drug you're taking and just look up the side effects. And I couldn't tell you how many people came in with headaches. And then some of the side effects of the drugs they're taking is constipation and headaches. So, it'll amaze you as you're taking a drug for a problem, and one of the problems is a side effect of the same symptom that you're taking the drug for. So it's truly amazing. It is.
Yeah, Ron Adams just said the list of side effects on many meds is longer than the list of benefits. 100% it is, Ron.
Thank you, Ron. Hey, good seeing you, Ron.
So, I think about what I did this morning is I made a list of your 7 your web of physiologic dysfunction from your book, and the 7 different levels there are of that. And I started thinking about a guy that came to see me several years ago. He's one of those cases, Andy, that his parents brought him in. Guy was in his 40s, and he had braces on both wrists, and was in constant pain all the time. Couldn't hold a job, and just head hung low, just depressed out of his mind. He had that, like, when people aren't well and they have that kind of grayish hue to them.
Yep.
So just going through the list, number 1 is oxygen, number 2 is glucose, number 3 is activation. Just thinking back about Dan, that was absolutely him. His nerves were just not getting the fuel, the activation that they needed, and his brain was degenerating at a very rapid rate. Autoimmunity and inflammation, I think, is number 4 and number 5. Those 2 things go hand in hand. Autoimmunity is basically, people think of autoimmunity as I have to be so sick that I actually have a name for my disease, like rheumatoid arthritis or Sjogren's or lupus or whatever. But there are subsets to that where you can have autoimmune reactions and not have the symptoms that are bad enough for someone to give you a label and throw drugs at it.
Right.
So I would venture out to say that every person that walks into our office has some portion of autoimmunity that's happening with them. Inflammation goes along with that. Then you throw in neurotoxins at 6 and the brain-gut connection at 7. Dan was going through every single one of these. So what we did with Dan was put him on a brain rehab diet, a diet that was good for his gut and his brain. And then we got him doing some brain-based exercises. And it wasn't very long. I don't remember the timing exactly. I'll have to dig back through my archive of YouTube videos. But Dan's wrist stopped hurting. His depression cleared up. You could see the glow coming back into his skin.
Yep.
And all of a sudden he's back to work and providing for himself. And, that's a big deal for a 40-something-year-old guy to have to go through something like that.
Absolutely. And one of the things you hit on there is, once you are given a diagnosis, especially from a neurological standpoint, you're virtually an end stage, pathology. By the time you've had so much neurological or whatever it is, damage. Why do we want to get to that point of, because I have people that come in, it's like, well, I'm not diagnosed yet. Good. Okay. I'm glad, because once you get diagnosed, that means you've got so much tissue destruction that you've destroyed so much of your body that, hey, we actually have a name for that. And again, if people look up Alzheimer's, the Alzheimer's Institute's already given us 7 stages of Alzheimer's. And then basically stage 1 is I don't have any symptoms at all, meaning that I'm cognitively aware and alert all the time when I'm awake, of course. Then we get into stage 2, and the first thing that happens in stage 2 is that we lose focus, attention, and concentration. That's when we want people in the clinic, because we've already got a brain that's damaged, and we want to see them then. But the problem is they just laugh it off. They shrug it off. The doctor is saying, well, you are getting older. A person's probably 40 or whatever, and
right.
then their kids are like, don't worry about it. You're 40. 10 years later, now they have working memory, which means they moved into stage 3, stage 4. Working memory just means that you walk into a room and forget why you walked in there. You call someone on the phone and forget why you called them, or you're in conversation, you forget what you're talking about. And senior citizens tend to call that a senior moment. Well, what happens when you're 50 and that happens? and then we move into that advanced stages of stage 4, just more memory loss. And then something funny thing happens. Well, it's not funny. It's very serious. It happens at stage 5. Is that all of these years and decades that the person said they had problems, their brain is actually deteriorating to the point at stage 5 that they don't even see themselves as the problem anymore. Everyone else is the problem. And then they become unmotivated. They don't want to do anything. And then at stage 6, people start peeing and pooping on themselves. And then they move into stage 7. And the average person lives in stage 7. Oh, and by the way, usually at stage 6 or 7, just for people who are waiting for a diagnosis, you typically will not get diagnosed with Alzheimer's until you're in stage 6. And then here's the point: once you get into stage 5, you've got so much neurological damage at that point, you've lost that golden window of opportunity to actually slow this thing down and possibly, if not, reverse it. So, and see, at stage 5, you're not even diagnosed yet. So don't wait to that point. It's crazy, man.
Well, I mean, all these people, they give you all these excuses of, well, I can do it, I'll do it after Christmas. I'll do it after New Year's. I'll do it after what the heck ever. Yeah. The reality is that time is going to sneak up on you, and you will cross that point of no return.
Exactly. And if somebody told me that, I would tell them at any point of this, time is of the essence. So what you're telling me is, and again, I'm going to go back to this termite analogy because I love using termites as an analogy.
Because we don't have them in Idaho,
Yeah. And because, I'm like, if you had termites in your home every day, 24 hours a day, just gnawing away at the wood, and you knew they were in there. Mm-hmm. I mean, when you say, let's wait till after Christmas before we do something about this, and we're talking about a house here. And, and I tell patients all the time, we're not talking about a home. We're not talking about a used car, because typically the care plans that I go over is to change someone's life is the investment of that is going to be about the same investment as buying a used car, a nice used car. It's not like, so, and people have to decide, are you worth it? Are you worth investing in? And sadly, some people don't even see themselves as being worthy of being invested in. And it just blows my mind when you have a married couple and then the wife has told the husband, it's like, I'm not going to pay for that, because you may be dead next year. And then I got to pay. So anyway, I'm just like, what? So my mind just doesn't think that way. If they had a problem, and I would like to share this with people too, and I use this quite often, is that if you have a problem that money can solve, you don't have a problem. It's this only the problems that money can't solve is in which you have a problem. Let's use an example of Steve Jobs. At the time, the wealthiest man in the world, and he had a problem money couldn't solve. He had pancreatic cancer. Okay. Mm-hmm. And so with all of his hundreds and hundreds of billions of dollars, he wasn't wealthy. He didn't have enough money to save him. And so, see, even the wealthiest man in the world at the time had a problem money couldn't solve. And most people that I see, they have a problem that money can solve. And so they don't really have a problem. Right. Like, for example, I'll give you an example. I had to get my patio in my backyard and the balcony fixed because it was dilapidated because of just years of wear and tear. So, when we got the patio and balcony fixed because we had a problem money could solve, and we got it fixed, and now, Faye's happy, I'm happy. So, and so that, I want people to really understand that, for most of the clinics that I work with, if you're beyond the stages of being helped, we will tell you that. I have to tell people this, and I don't like having to tell people this. I actually have to carry this home to my wife, and I don't like doing that. But part of my job description is to let people know when, hey, you have gone too far, and there's just nothing that can be done. And I'm sorry, I wish you would have came in 10 years ago. But it's that's what I want is for people listening today is if you're already in that brain fog, that focus, attention, and concentration, my email is in my book. Okay. And just email me and we can send you to a doctor if it's not feasible for you to come to see me or Brady, because I don't know where you live. Right. And, we have a network of doctors who can help you. But, just don't wait. We're just talking about, all the time. Don't wait till you get into stage 5 and go, hey, I want to do something. Well, by the time you get into stage 5, you won't be the one asking for help. It'll be your kids asking for help.
Right.
And so that's the problem with stage 5 as well. So,
which one of your emails is in the book? Is it Ask Dr. Barlow?
Yes.
.afni?
It's Ask Dr. Barlow _AFNI@yahoo.com. And
put that in the comment section.
I'm sorry?
I just put it in the comment section.
Okay. All right. Thank you. And that way, again, if you're listening and you expect me to do some kind of diagnostic testing or something like that over the phone or the internet, that's just not going to happen. Okay. And I'm going to do a person a grave disservice by doing that. And I'm not going to, we're going to find you a doctor that's been through my AFNI training in our network and I will co-manage. I will co-manage you with that doctor. So you got two doctors working for you for the price of one, if you will. And because, I have a mission, and that is I want to change people's lives. At this Orlando seminar, one of the doctors from Nashville, Tennessee came up to me and said, man, he's like, you have no idea how many lives you've changed just by me coming to your seminar. So, and this doctor took the initiative to come through my entire program and go back to Nashville, Tennessee. And he is literally changing people's lives that he just couldn't do before because he just didn't have the background for it. And now he does. And he was, and man, I tell you what, that just made my day. That, it's just something about when you change people's lives, but then when you change a doctor's lives and give him a better skill set, a greater skill set to go home and change his entire community. That's just another level of I don't know, just of sheer awe and amazement at that, because being able to help people that you will never meet in your life by sending them to a doctor who's been through my program is very extremely rewarding. So
yeah, I can't even imagine. Well, I think we got to wrap it up for today. It's been great as always. I won't leave. I have just a couple of thoughts that I think we should wrap it up with.
Okay.
And one of those is, when you're picking a doctor, if you go to like Yelp or wherever people go to see doctors' reviews,
yeah,
I think it ought to be published what that doctor's BMI is and how many medications they're taking.
Yeah, I agree.
Yep. Because a good doctor is one that will get you off of medications, not add more.
Yep. Mm-hmm.
So,
and well, I'll give you an example. We were this is a couple of years back, and there was a huge billboard, high definition billboard in downtown Tupelo, and one of the doctors that was on there, and I'm just like, if she weighed an ounce, she weighed 350 pounds. And I'm like, how in the world can somebody look at her and take healthcare advice from somebody that weighs 350 pounds? But to see, that's how distorted our healthcare system is that you got a person who's taking no health advice, giving you health advice. And here's another one. If the doctor giving you the advice is more unhealthy than you are, stop listening to that advice.
Exactly.
All right, Brady, man, I appreciate you, and I love you, and I respect you, and I just can't say enough good things about you, brother, and appreciate you having me on here today.
Yeah, we'll see you next week, Andy. I love it. Thank you.
All right, see you, Brady. Bye-bye.